A person once told me that to become successful, you need to find your niche in life and develop a skill within that niche. Once you've done that, make sure you become the best at it. I assume someone told Novo Nordisk the same thing, judging by the sheer scale the company has reached in recent years. From being a well-known name in the global pharmaceutical industry to, at the time of writing, becoming the most valuable company in Europe. This transformation wasn't achieved through aggressive acquisitions or mergers with competitors, but by simply creating extraordinary products with extraordinary capabilities. It's amazing to see a company hailing from one of the smallest countries in Europe accomplishing such a feat, surpassing established European giants like LVMH, Siemens, ASML and Inditex, just to name a few. But Novo Nordisk didn't arrive here by accident. Their latest success is not the only thing they are known for, nor is it the reason they became a giant in the pharmaceutical industry in the first place. To understand the position they are in now and what it means for the world, we need to go back and explore how a company from such a small Nordic nation managed to outshine its peers and claim the title of Europe's most valuable company. The journey of Novo Nordisk began in the early 1920s, a time when diabetes was often a death sentence. In 1921, Canadian scientists Frederick Banting and Charles Best discovered insulin, a breakthrough that would change the world of medicine forever. Around this time, August Krogh, a Nobel Prize-winning professor from the University of Copenhagen, embarked on a lecture tour in the United States. Encouraged by his wife Marie Krogh, who herself had diabetes, he made an important stop in Toronto, Canada, where he met Banting and Best, the pioneers behind insulin production. Recognizing the immense potential of insulin, Krogh secured the rights to produce it in the Nordic countries on one condition, and that set the stage for a medical revolution. Returning to Denmark in late 1922, Krogh knew he had a rare opportunity to transform diabetes treatment in his home country. He described his mission as a duty to bring the benefits of insulin to those in need. This commitment led to the establishment of Nordisk Insulin Laboratorium in 1923 alongside H.C. Heydorn and August Kongstedt. From the beginning, the founders structured the company around a foundation model, ensuring that profits from diabetes medicine would be used for scientific and humanitarian purposes. This principle aligned with the one condition mentioned earlier for the agreement that Krogh had made with Best and Banting. However, tensions soon arose. In 1924, a pivotal event would reshape the whole industry. Heydorn had dismissed one of his most trusted employees, a person named Thorvald Petersen, who was a skilled pharmacist and chemist. Harald Petersen, who was his brother and who worked alongside Thorvald, in an act of loyalty chose to resign as well. He was another key employee working under Krogh, and this decision led to a defining moment in the company's history. Due to this event occurring over 100 years ago, it's difficult to pinpoint exactly what happened regarding the whole debacle and the reasoning for the dismissal. But what we do have is accounts of a conversation that took place during the fallout between the two parties that went as follows.
What are you going to do? We want to make insulin. Well, you'll never manage that. We will show you.
With determination, the Petersen brothers went on to establish their own company, Novo Therapeutisk Laboratorium, marking the beginning of a fierce competition between Nordisk and Novo. This rivalry would drive both companies to new heights in insulin production and medical innovation. The dice was now cast for decades of rivalry between the two companies, two images and two cultures, but both with the same overall objective: to develop and manufacture world-class diabetes medicine. Heydorn, Krogh and Kongstedt belonged to the established social and intellectual elite with deep roots in the scientific world. The Petersen brothers, on the other hand, lacked these prestigious connections and instead positioned themselves as resourceful manufacturers, emphasizing their entrepreneurial spirit over academic accolades. Despite having less expertise in diabetes, pharmaceuticals and business operations compared to their former employers, their perseverance and ingenuity allowed them to thrive. August Krogh in the end had to eat his words. Harald and Thorvald Petersen not only succeeded but surpassed expectations, and thus a rivalry between the two companies raged on for several decades. Changes to leadership, changes to company structures, and way of conducting business followed, but so did innovation in the diabetic field, which only helped cement these two giants as Denmark's, at the time, most important companies. But despite this, their reach was still limited due to the overall size of both companies. So to better position themselves on the global market, they followed the old saying, if you can't beat them, join them. By the mid-1980s, Novo and Nordisk were two large Danish pharmaceutical companies competing fiercely in the same industry. While talks of a merger had circulated in business circles for a long time, deep-rooted historical, cultural, and personal rivalries prevented any immediate agreement. However, in January 1989, a monumental decision was made. The boards of the Novo Foundation and Nordisk Insulin Laboratorium issued a press release announcing their merger into the Novo Nordisk Foundation. This move culminated in one of Denmark's largest corporate mergers, creating Novo Nordisk AS as we know it today. The merger brought a powerful force behind the foundation's mission, ensuring a stable foundation for commercial and research activities. It also allowed for greater profitability and enabling the foundation to significantly expand its grants for health research. The creation of Novo Nordisk marked the beginning of a new era in diabetes care and pharmaceutical innovation, which can be summarized by a couple of new inventions from the company, such as the world's first insulin pen, giving patients the opportunity to inject themselves with insulin in their own home discreetly and effectively, as well as insulin pumps, which became much more widely available, ensuring that people with diabetes can benefit from having their insulin released as needed and when required throughout the day. Incredible innovations for sure, and many more were created through the years, which led Novo Nordisk to become one of the biggest players in the international insulin market. However, one particular innovation would lead to their biggest creation yet, and that would be the specific use of a hormone named GLP-1. GLP-1 in itself is nothing new. It was discovered by a scientist named Joel Habenier in the 1980s. The reason this hormone was considered special is that it was found to regulate blood sugar levels. However, in its original form, it proved ineffective as a treatment. Still, this did not deter people from researching into the hormone. Fast forward to the 1990s when another scientist, Dr. John Enck, made a remarkable discovery. In a stroke of luck, he identified a variant of GLP-1 in a venomous lizard known as the Gila monster, native to the deserts of Mexico. This version of the hormone lasted much longer in the body and had real potential as a diabetes treatment. Novo Nordisk soon began conducting its own research into exploring the medical use of the GLP-1 variant. When testing their own version of a drug on lab mice, the company succeeded in developing a formula that lasted long enough to be absorbed by the pancreas, thereby regulating blood sugar levels effectively. But during these trials, they also discovered an unexpected side effect on the mice that they were testing on. The mice began losing weight. The drug that would emerge from Novo Nordisk's trials with the GLP-1 hormone was called semaglutide, and it became known commercially as Ozempic. Now, while Ozempic did help patients lose weight due to its ability to regulate hunger, Novo Nordisk could not initially market it as a weight loss drug. This wasn't because weight loss drugs hadn't been tried before. Obesity is a serious crisis affecting much of the world, and their traditional method of losing weight through hard work and discipline is a difficult and time-consuming process for many. That's why the idea of a quote-unquote magic pill that causes weight loss has always been enticing, primarily because of the massive profit potential. Many companies have tried, but almost everyone has failed. This meant that if Novo Nordisk wanted to release Ozempic in the US market and obtain FDA approval, they had to position it as a diabetes medication. It took a long time, but in 2017, Novo finally received the necessary approvals and Ozempic hit the market. Ozempic wasn't just an incredible drug because of its blood sugar regulating and weight loss properties. It also required only one injection per week, which made it highly convenient for patients. All these factors made it a revolutionary product. Although it was marketed officially as a diabetes medication, many people began using it for weight loss. This was no accident. Novo Nordisk heavily promoted the drug through commercials and campaigns that subtly emphasized and mentioned the weight loss side effect. This strategy worked wonders for the company, but it still wasn't enough. Fortunately, Novo Nordisk didn't have to wait nearly as long for FDA approval to market semaglutide specifically for weight loss. In March 2024, they received the green light and launched the drug under a new name, Wegovy. Saying that Wegovy and Ozempic for that matter becoming news stories would be an understatement. These two drugs became a global phenomenon, featured in countless news cycles and hailed as the next quote-unquote wonder drug. They even made their way into pop culture. That's not to say these drugs were without their own issues, both medically and socially, but there's no doubt that they sparked international interest in Novo Nordisk and played a major role in the company becoming Europe's most valuable company. Novo Nordisk, who was already a pharmaceutical powerhouse, saw its market value skyrocket in just a year. This officially made it the most valuable company in Europe, surpassing the luxury empire LVMH, which had long held the top spot. And just to put this into perspective, in January 2023, Novo Nordisk was valued at around $250 billion. By mid-2024, it had doubled in value, reaching over $500 billion. In some months, its stock was rising faster than any tech company on the planet. Novo Nordisk's rise was so dramatic that it reshaped Denmark's entire economy. The company became so valuable that it single-handedly impacted Denmark's GDP, strengthening the Danish krone and forcing the country's central bank to intervene to stabilize the currency. But with great success also comes great competition. Novo Nordisk may have been the first to truly commercialize the GLP-1 revolution, but it's not alone anymore. Other pharmaceutical giants are now racing to catch up. Eli Lilly, who is Novo's biggest rival, has introduced Mounjaro, another GLP-1 based drug that is quickly gaining traction. In 2023 alone, Mounjaro generated $5.2 billion in revenue, and analysts expect that number to triple in the coming years. Some even predict that Eli Lilly's market cap could surpass Novo Nordisk's if the competition intensifies. Meanwhile, Swiss pharmaceutical giant Roche has entered the game, striking a $5.3 billion deal with Zealand Pharma to develop its own GLP-1 based weight loss treatment. Roche's deep pockets and global reach make it a serious contender in this space. And then there's China. Novo Nordisk's patent on semaglutide is set to expire in 2026, and at least 15 Chinese pharmaceutical companies are already working on generic versions of Ozempic and Wegovy. If these companies succeed, they could flood the market with cheaper alternatives, significantly cutting into Novo Nordisk's dominance. But Novo Nordisk isn't sitting still. The company is already investing billions into expanding its manufacturing capacity to meet demand. Factories in Denmark, France, and the US are scaling up production, ensuring that Novo Nordisk can maintain its supply advantage. Additionally, the company is developing next-generation GLP-1 drugs, aiming for longer-lasting versions that require fewer injections and offer even better weight loss results. Ultimately, the next big leap would be a pill that can be marketed and approved like a normal supplement, but those days may still be long away, but it's interesting to see who will get there first. What lies ahead for Novo Nordisk is difficult to predict. Even as it retains the title of Europe's most valuable company, the current climate, both politically and economically, is highly uncertain. It feels like anything could happen at any moment, and frankly, I don't believe anyone is surprised. So what is Novo Nordisk saying about its own future? Well, to meet the growing global demand for its products, as mentioned before, Novo Nordisk is significantly focusing on expanding its manufacturing capabilities. The company is also actively hiring across various roles at its global production sites, aiming to build standardized, scalable, and flexible facilities. This strategy is designed to boost efficiency and maintain consistent product quality worldwide. In addition to infrastructure, Novo Nordisk continues to invest heavily in its innovation pipeline. It's hard to say whether Novo Nordisk can create another wonder drug or if Wegovy and Ozempic will stand as their magnum opus. But that's the thing about companies on Wall Street. You never really know who will rise, who will fall, who will be exposed, and who will claim the next top spot. I believe that it is this uncertainty and unpredictability that makes the world of stocks and Wall Street and the world of finance so fascinating. Thank you very much for watching. Please leave a like if you enjoyed the video and subscribe if you want to see more. This has been another tale from Wall Street, and I'll see you next time.